This is someone we recorded in our sleep lab. He's in dream sleep right now. He is asleep. You may recognize some of this behavior in your loved one. Now imagine sleeping in the same bed with him. Sometimes you can get accidentally slugged. This is not someone who's normally aggressive, and this is a condition that affects people in their sleep. So it's not due to post-traumatic stress disorder. It's not due to depression. It's not due to anything but what we call neurologic causes. First-line treatment is clonazepam or Klonopin at a low dose. We also start low and go slow. And generally, we only treat it if there's been any injuries, either to the patient or to the bed partner. And I show this because I think it's all too common that this goes on and it goes untreated because people are embarrassed. Well, my husband beats me up in sleep, or my wife beats me up in bed. It's not something that people volunteer unless we as clinicians specifically ask about it. But it is treatable, and I would encourage you, if it is a problem, to seek treatment for it. Just want to touch a little bit on suspiciousness. This is probably the number one cause of nursing home placement. People just get to a point where they just, can't cope. And I think, as we stated earlier, we first want to look for physical causes, pain, infection, whatever, dehydration, environmental causes. I had a patient once who was convinced and very angry that no one would believe her that there was a intruder living in her garage who would come and spy on her, and in the middle of the night would even take food from her refrigerator. And she started to lock the door. But then she noticed that he moved to the basement. So then she couldn't keep him out. And the children thought this was part of her Lewy body disease. Oh, it's time to move mom out. And, it was really difficult until one day the children actually went downstairs. And they discovered a teenage homeless kid living in her basement. So check, even if it seems ridiculous, or even if the person does have beliefs that really aren't true, check anyways, because sometimes they are true. Changes in routine, certain times a day can cause some, agitation. Going into a new or unfamiliar situation can cause agitation. Not being able to find the bathroom when you have to go to the bathroom can cause agitation. So any ways that we can try to modify the environment is worth it. There's a term I want to use called adaptive paranoia. And adaptive paranoia is when someone says, they're thinking, I don't understand what's going on, but I better protect myself. And I will just tell you this one last story, and then we'll wrap it up. One of my caregivers named Ed was caring for his wife, Frances, and he thought, well, let's take this one last trip to visit the kids. So they had to stay overnight in a hotel. And he decided, well, it might be easier to stay in one of those motor lodges, so you just drive up and you walk in the door and you don't have to go through a lobby, or, it would just be easier. And when they were getting ready for bed, Frances basically freaked out. And she had a catastrophic reaction and said, who are you? Why do you want me to take my clothes off and go into bed with you? How on earth do you expect me to stay in this room with you? Who are you? And she got so terrified that she ran out of the room and went to the front desk and complained that there was some strange man who was trying to hurt her and assault her and get her to do things that were unmentionable. And lo and behold, Ed shows up in the office, and the front desk guy's glaring at him and I'm going to call the police. And he called the police. And this is a true story. I'm not kidding. And Ed thought, what am I going to do? And so the police show up. She's shaking and crying and sobbing, and he's just in a corner, and she's pointing fingers. That's the nasty man. And the policeman walks in and, basically says, well, sir, you're creating a disruption. Let's go outside. And so one of the police officers spoke with the wife, and then the other police officer spoke with Ed. And basically Ed told him, look, my wife he just said Alzheimer's disease because people know what Alzheimer's disease is, and tried to explain the situation. So what they did was they walked back into the office, and the police officer said to Frances, good news, ma'am, we found your husband. Here he is. He must have just stepped out for a minute. And we apprehended the other man. Oh, wow, she hugged him. She was so relieved. You wouldn't believe what terrible things happened. And they went back to the hotel room, and she was fine. So this is an example of she just didn't understand what was going on, but Ed handled it in a very good way, and fortunately the policeman believed him. And that's something we kind of also call the therapeutic fib, where maybe we say something that isn't 100% true, but just to, have our loved ones' feelings spared. Very important that you care for yourself. Try not to take things personally when they happen. Accept your limits. We all have limits. I mean, do you have a bad back? You can't lift your loved one? Is it just too emotionally draining for you? Are there problems that you just, can't cope with? And set up a schedule and delegate. Don't wait for people to say, what can I help you with? Say, look, I need someone who can sit with your dad on Tuesday and Thursday because I have to go to this caregiver support group. I need someone who will bathe him on X and Y days, or whatever it is that you feel that you need. Some people don't find the physical care a problem, but really need someone who can maybe just stay with their loved one for a period of time so they can go out and just go for lunch, or go to work out, or have some time to themselves. You have to decide what your limits are, what the limits of those around you are, and either use people who are maybe, if you're lucky enough to have family who wants to help. Many people don't have family either that are around or that want to help. So then you tap into other resources. Day programs. You tap into in-home assistance, volunteers, respite care, other assistance. Have realistic expectations. I think that we often believe this is it, especially when someone's having a fluctuation. Oh, he's cured. And then crash, and it's a real disappointment. Have realistic expectations of what to expect, and then you might be able to better appreciate the simple pleasures. Just as a review, understand the losses, recognize the potential for excess disability, and take care of yourself. I like this quote by Helen Keller: "The best and most beautiful things in the world cannot be seen or touched, but are felt in the heart." And I think that's the basis of being a caregiver. We give from the heart. And here are some books that I would highly recommend. The Best Friends Approach to Alzheimer Care is outstanding. They have 2 books, one that's for staff, nursing home staff, one that's for family caregivers. Fantastic book is Your Name is Hughes Hannibal Shanks. It's really a wonderful memoir and very good tips. And then Creating Moments of Joy is a very nice, very handy little pocket book that just has some very easy suggestions on how to cope. And I want to thank you so much for being so patient and for hanging in there with me.